Have you ever been to a chiropractor or ever been adjusted?
Do you understand the health benefits of getting adjusted?
I'm Dr. Lanzano.
My name is Dr. Grayson, and today we're going to talk about the chiropractic adjustment and the benefits of it. Alright, welcome back to another segment of Get Off My Nerves. Like we said, today we're going to talk about the chiropractic adjustment and the benefits of it. First, we're just going to let you know what we're going to talk about. We're going to go over a few different methods that we use in our office in order to get you adjusted. We're going to show you how to use a drop table. We're going to demonstrate an activator adjustment, and then we'll show you a manual adjustment as well. But before we do that, we're going to get into the mechanism behind the adjustment and what we're actually influencing in the body. So Dr. Lanzano is going to talk to you about that.
Okay. So, as chiropractors, we're nervous system doctors. So what we want to focus on is freeing up any interference from your spine to where your nerves go in the body. Here's a big spine. These are your vertebrae. Okay, and these yellow objects here are your nerves. So, if you have any misalignment in the body, which is a rotation, whether it's arthritis, misrotation, it's going to cause interference on these nerves. And you're going to have a poor signal. So what we focus on is keep a proper alignment here so there could be proper signaling where these nerves go into the body. Perfect example, I like to use the landline phone. Yes, I'm young, but I know what a landline phone is. So if I'm on this phone and someone cuts this cord, there's going to be a disconnect. I'm not going to be able to hear the person on the other line. It's the same thing with your spine. If you have a misalignment or any underlying circumstances here, such as arthritis, misalignments, degenerative disc disease, herniated discs, it's going to put pressure on this nerve and you're going to have that same interference. So we want to focus on keeping everything aligned so your body can function at its optimal level.
Alright, so again, with the adjustment, what we're doing is we're influencing the nervous system. And the nervous system controls everything in the body. What we're known for in the general population is, treating the neck and the back for pain, mechanical pain. And yes, we can have a great influence on that, but it's not just pain in the back. We can treat the extremities. We can help you with ankle pain, wrist pain, elbow pain, shoulder pain, TMJ. And again, it's not just pain. The nervous system controls everything. It gets into the autonomic functions, and that's what he's going to briefly talk to you about now.
So what people don't realize is we don't just treat neck and back pain like Doc mentioned. So, like I said, all these nerves go to different areas of the body. So if you have any interference with these nerves, which is caused by a misalignment or a herniated disc, it could cause other symptoms. For example, what we see is high blood pressure. Now, if you look at some research suggests that getting adjusted could help potentially lower blood pressure. What we see a lot in this office is headaches. We have a lot of patients go to neurologists and other docs, and they don't realize that just by getting proper alignment in their cervical spine could potentially help with headaches. We see with high blood pressure, we see with digestional issues, GERD, which is just indigestion. So there's other different areas that we could potentially help with that many people don't even realize.
Oftentimes when a patient has never been adjusted before, we want to start less invasive, so we don't go straight to a manual adjustment, but we can use different techniques such as the drop table, which I'm going to demonstrate, and next we'll show you how to use an activator. For this case, I've already done an assessment. I'm not going to show you that part, but what we're seeing here is his right SI joint, that hip joint, his pelvis is not moving well. So we're going to show you how we can adjust that without doing a full manual adjustment, but with using the table. You'll see this piece prop up, and then I'm going to use it and it will drop back down. What that does is it takes some of the force away from my adjustment on his pelvis, so it's not so invasive. So what you'll see here is this table is going to prop up, just like that. I'm going to make the contact on the joint that needs to be moved, and then I'll drop into it. You do it a few times. And then we recheck for motion. We can check to see if the leg length has changed at all, and it has. So that right there is a very simple, non-invasive way to get movement in one of the pelvic joints, and it's not very invasive. Alright, so right now we're going to show you another method of adjusting that we use in our office. This is called an activator. It's a handheld device, and this is going to be your least invasive way to get adjusted. So I'm not using my hands. I'm going to use the tool on you, and there's a variation of depth that you can get, but if you can see up close, as I pull the trigger, this comes in together, and then when I click it, it shoots back out. So it's actually inducing a force just like I would do with my hands. It's just much less force, and this is for people who can't handle the manual adjustment, if they're too tight and you can't get motion, or if they have never been adjusted and they have that initial fear. This is a good way to get over them. You can still get symptomatic relief, and it's just our least invasive method. So I'm going to do just a quick demonstration on his neck. So I'm going to look at his leg length. I'm going to have you turn your head to the left. We get a change there, so I'm going to keep your head left for me. Right here is where I'm going to make the adjustment. Go back to the middle. And all I do is put my thumb over the contact point where I'm going to adjust the depth of the tool to where it needs to be, and then add it in. And all I do is click that. The force has been introduced into the spine. It's much less than the hands, but it's still effective for treatment. Alright, so now we're going to demonstrate the manual adjustment. Chiropractic in Latin means done by hand, so that means I'm going to do the adjustment with my hands versus using the table or a tool. This is definitely the most invasive form of an adjustment, but it's still very low risk. It's very safe, minimal pain, and we'll just show a demonstration of it. We're going to do a lumbar adjustment, so we're looking at the lower end of his spine just above his pelvis, just to be congruent with the treatment that we already did. Again, I already did the assessment, so I know where I'm going to adjust. I'm just going to show you a demonstration of it, get them in a proper position, and I'm just going to take him and I'm going to roll him towards me, keep him on the table, and I'll just drop into it and we feel movement here. And that's a version of a manual adjustment.
Hopefully this video was informative and educational. Hopefully it eased your guys' mind about chiropractic. If you're interested, please come in. We're here treating patients at Soul Focus. We're willing to do house calls. Whatever you need, give us a call. We'll be happy to help. I'm Dr. Lanzano.
I'm Dr. Grayson.
Thanks for tuning in for another episode of Get Off My Nerves. And we'll see you guys next week.